The result goes well beyond just me. For the kids to have Dad around, I mean, words can't express what that means.
And the only thing she did ask, if I'm gonna die, this is the place where I want to die. I feel loved here. I don't want to go anyplace else. Do whatever you have to do, that I'm here.
It all comes from where his treatment started and how quickly they were to act on what they saw that was wrong. And he has 3 little brothers who he's the sun and the moon.
The staff at the White Plains Hospital knew what to do, and they did the right thing. And not only they did the right thing, they were very friendly to me and helped me a lot. I mean, she was the patient, but they helped me and my family.
Definitely, this saved my life.
"125 years ago, in 1893, my great-great-grand-uncle, Dr. Ernst Schmidt, came together with 23 women and 2 men with one goal in mind: to serve the community. They established White Plains Hospital, which was staffed entirely by volunteers and funded primarily by the community for the first 50 years. In the first year, the hospital treated 31 patients. In fact, my uncle made 44 house visits in one day on horseback. Uncle Ernst was very involved in improving the health of the community. He advocated for sewers to be treated as a public health issue. He established a school of nursing at the hospital. He worked with dedicated community members who contributed their time, and they raised money for the hospital's first horse-drawn ambulance, which was equipped by a local drugstore in town. Uncle Ernst moved the hospital twice, finally landing on the location where the hospital's main building sits today. White Plains Hospital is a legacy from the past and a trust for the future. It is a monument to its founders, and I am so proud to be a descendant of my uncle, Dr. Ernst Schmidt.
When Ernest Schmidt recruited my father-in-law, Dr. Edwin G. Ramsdell, back in 1908, he was the first resident physician for the hospital. 30 years later, he was appointed the Chief of Staff and Director of Surgery. Later, following my father's footsteps, my husband, Dr. John A. Ramsdell, became Chief of Staff. In addition to the men in my family, my mother-in-law was also one of the first graduates of the nursing school. In fact, during the Depression, the women of White Plains were more committed than ever to helping the sick in our community. A women's auxiliary had been established, and women really became a force at the hospital, volunteering as clerical workers, messengers, seamstresses, social workers, and drivers. During the war years, volunteers took over the care of bed linen, provided vegetables from their gardens, and through their work, offset the huge number of doctors and nurses who were sent overseas. Philanthropy played a crucial role during this period. In 1956, the auxiliary hosted the first White Plains Hospital Gala. A new Dixteen pavilion was constructed to add new beds, a laboratory, an intensive care unit, and a cardiac care unit. In 1981, John Chandler was named CEO, ushering in a new era of growth for the hospital. He occupied the role for the next 35 years.
As I got off the train, White Plains was an open, empty lot. And between the train station and the hospital, there was nothing. The hospital had always done a good job, always had a good reputation, and served not just the city of White Plains, but served the entire community, which was 250,000 people in central Westchester County. The campus master plan really goes back 25, 30 years. And what we always said was that we delivered excellent health care. We needed the facility to back up and to support the excellence in health care that we were delivering. And so it was the Flanza Pavilion, it was the Benheim Pavilion, and many firsts in the county, including a level 3 NICU, the first cardiac care unit, and the Dixteen Cancer Treatment Center, the only freestanding cancer center in Westchester County. All of these things were part of a plan to make sure we had the best facility available And Sidney Frank, a good friend of the hospital, donated the largest ever single gift to establish a new front entrance of the hospital.
So John's impact on White Plains Hospital was extraordinary. As he began looking towards retirement, he looked for a successor who could carry the hospital into the future. And when he met Susan Fox, John knew he found the leader who had what it would take to guide the hospital in this new, uncertain era. We've always had a fabulous medical staff, but now we have physicians leaving other institutions because they hear this is the place to be. And our physicians want to take care of people in their community. They want the care to be personal. And Susan was able to build on this to vastly expand the number of physicians employed by and affiliated with the hospital. She was instrumental in the affiliation with the Montefiore Health System in 2015, which is one of the organization's largest milestones and its most strategic move to set us up for future success.
There was great synergy immediately between us because Montefiore's mission was to keep as much of the care in Westchester and White Plains.
Our institutions have partnered to bridge the divide between academic medical centers and community hospitals, and in doing so will give Westchester County the best of both worlds. As Susan assumed the role of President and CEO in 2015, she took the reins of the greatest expansion and transformation in White Plains Hospital's history. A new entrance and lobby, new private patient rooms, new operating suites, labor and delivery suites, a second cardiac cath lab, new patient waiting areas, and a renovated and expanded Center for Cancer Care have all brought the hospital to a new level, making it a true destination for advanced care. None of this would have been possible without philanthropy from the community and the support of Montefiore. This hospital was founded and built with the support of its neighbors. We have relied on the community so that the community can rely on us.
I think that if Ernst Schmidt was here today, he would marvel of what he sees. His care for the common person is reflected in the way that the White Plains Hospital operates today.
I'm here with my grandmother, Geraldine. She's actually living out her last days here, and every doctor, nurse, and staff has been going above and beyond, and we could not be more grateful. This has been the hardest day because we found out that, we're going to be saying goodbye, but even in this moment, it's not sad because everyone's just smiling and making us feel like we're at home.
We're here to see Grandma Lane because she's not feeling well, and we really want to visit her. And it seems like that they're taking really good care of her.
5 weeks ago, I had my second child here. There is a unique atmosphere of love and kindness here. Thank you. Thank you for loving the moms and the babies.
I think it's important for people to support White Plains Hospital because they have a bunch of really great nurses and doctors and a lot of amazing tech. And they really want the patient to go home, but they will be very, very good about making sure they're healthy and safe.
We're very grateful for White Plains Hospital for taking great care of my wife and bringing our little babies into the world.
I got involved at White Plains Hospital. It started over 60 years ago when I was born here. We also had various surgeries here and one life-changing surgery for our daughter, which is when we started to get really involved at the hospital.
I just want to say thank you to everybody who donates to White Plains Hospital. I'm pretty lucky because fortunately I'm able to invest in saving other people's lives by investing in White Plains Hospital. It's absolutely critical that our community supports this hospital.